Okay. Okay, so here we go. We're starting now. Hello, everyone, and welcome to our online event, The Power of Data, bringing to light research on LGBTI homelessness in Europe. My name is Nadia, and I'm a senior programs officer at ILGA-Europe. I will be your host today. I have with me Nuriko, also my colleague from programs team at ILGA-Europe. She will support me in co-hosting this event and also in facilitating the discussion and questions and answers that we will have time at the very end of the event. For those who've just joined us, I just noticing that we are recording this session, so it'll be available later on light for the wider audience and for the media as well. Today we have with us 5 organizations and 5 activists that are representing them. I will introduce them in detail before each of them speaks, but let me just name them at the very start. So today as guests and as presenters, we have Silvio Maggina, co-founder and project manager at QUORE, the organization in Italy. Sonika Francis, the founder and director of the Black Sex Worker Collective, the organization in Germany. Gemma Bruyes, president and founder of the Ahora Donde the organization in Spain. Rodrigo Araneda Villasante, president of ACATHI, also the organization from Spain. And do we have already, I don't know, do we have, yes, Simona Murshets just came in, president of Ljubljana Pride, the organization in Slovenia. Thank you so much for coming in today, all 5 of you, to hold this space together, to share your knowledge and your insight when it comes to LGBTI homelessness and related issues in your local context. I will say at the beginning a few introductory words before I will pass the floor to our presenters. As you probably know, this event brings together these 5 groups. Each of them have done research in the last year or 2, or in case of Ljubljana Pride, a couple years back, on LGBTI homelessness. And actually, these organizations have been addressing LGBTI homelessness in their local context for much, much longer. We all gathered here today because I think we all know very well that LGBTI homelessness across Europe is an important issue. And probably it will become even more important given the political climate that we're living in. And yet it is largely remains an invisible issue as well. And as you know, in many countries, there is little or sometimes no data on LGBTI homelessness. And without it, there are really no targeted services. It's very hard to advocate or promote specific policies, and it's hard to advocate or get funding to address this crisis, which leaves LGBTI organizations and groups to fill in the gaps, and very often with very little resources. So 2 years ago, ILGA-Europe offered support through the No One Left Behind fund to 5 groups to gather data on the national level or on the local city level and turn this data into advocacy asks and advocacy tools. And all these 5 groups are here today to share what they found and what they would like policymakers to do. The research, as you will hear, that groups will present today is quite different in scope, in methodologies, in objectives. So I hope that these presentations will give some volume to the issue and will bring different angles and perspective to the table. I would also like to mention that along this journey, some of the groups were supported when needed by our colleagues and mentors from Analysis Group, which is the international economics consulting firm, who has been a pro bono partner of ILGA-Europe now for already 2 years. They have been supporting learning of various LGBTI groups when it comes to data collection and data analysis. And I know and I see that there are some Hi, Mario. There are some colleagues from analysis group here today, so thank you for being alongside us and some of the groups on this journey. So the idea of today's event is really to give opportunity for all 5 groups to share key findings and policy recommendations from research and activism that they've been doing. So in terms of the structure, we will have 5 presentations back to back, around 8 minutes each. So for the next 40 minutes, it's going to be presentations, and then we will have around 30 minutes for questions and answers, comments, discussion. Yeah, when you listen to the presentation, if you have questions, you can type them into the chat, and Nuriko and I will collect them, and we'll be able them to cluster them and bring into the discussions as many questions as possible. So they will be addressed at the end. So without further ado, please allow me to introduce our first speaker and presenter. It's Silvia Maggino, co-founder and project manager of QUORE, the organization that was founded in Turin, Italy in 2007. And as a non-profit organization, its mission is to fight against all form of discrimination based on gender identity and sexual orientation. They do it through awareness-raising campaigns, projects, advocacy, training, and activities. And over the past, I think, 7 years, QUORE has been strongly committed to the addressing LGBTI homelessness, specifically through their 2 housing project, which is the biggest housing service targeting the LGBTI community in Italy. And 2 housing welcomes and work closely with LGBTI youth, but also LGBTI refugees, migrants, and asylum seekers of all ages, as well as transgender and gender non-conforming people also of all ages. So Silvia, the floor is yours.
Great. Thank you very much, Nadeja. I'm amazed to see all familiar faces and fellow activists and amazing colleagues. So I'm quite happy to be able to present our project. Looks like I'm going to be the icebreaker today. So I'm glad to start this lot of presentation. QUORE, as Nadeja mentioned, is working in Italy, and it is mainly committed to the topic of LGBTI homelessness. We are doing, and in general, LGBT marginalization and exclusion of LGBTI people. This very project indeed stems from our main activity, that is co-housing. Co-housing is not a shelter, is not a dorm, it's an housing service that is strongly based on a support program that has allowed us over the time to study deeper the topic and to better understand the need of all the people that we are hosting. We are hosting everyone who identify in the acronym of in the LGBTIQ plus community. I'm going straight to the point to present the Pride project because I only have 6 minutes and a half left. I have a short presentation actually. Here it is. I think you can see it.
Yes, we can.
Okay, let me go. I don't think. Okay. So the project at a glance, we build the project around 3 key pillars. The Pride acronym means preventing and reducing inequalities using data and empowerment. These 3 pillars are the national research, the creation of a network of housing services in Italy and anti-discrimination center, and some advocacy activities, advocacy tools, and advocacy activities that we have been launching last year here in Italy. We were able to perform all these activities thanks to an amazing partnership. I'd like to mention above all the University of Torino and Padua, whose researchers conducted the whole research, to young, brilliant, smart, amazing researchers. Other partners include other housing services scattered around Italy. Here is a quick map of the services that we were working with. And it's the very first time that housing services gathered in Italy to discuss methodologies and to find new strategies together. About the research, so I will be focusing today only on the research, on the national research. It is the very first research that has been developed in Italy around the topic. The research goals, as you can see, is basically analyzing the experiences that the people that we hosted had around housing deprivation and marginalization and exclusion. And of course, analyzing, but I will describe it better later, the interrelation between the impact of our services and the well-being of the people that we are hosting. I would like to stress that because the well-being of the people that we are, of LGBT people, is at the very core of our work and in this research in particular. As far as the methodology is concerned, we launch questionnaires and semi-structured interviews to over 30 guests and also to around 20 staff members of the housing services and the anti-discrimination centers. I would like to show you this words cloud because all the research is about those keywords. So I think that most of you are familiar with the minority stress, for instance, and this model has somehow guided us through the research development as a result of social stigma that people is experiencing because of gender identity and sexual orientation. And stigma also acts like a mechanism of exclusion. And we were able to report exactly how it is working by tracking the perceived and experienced stigma. There are several charts that you can see in our research. I will explain you later how to download the research. Then, of course, we track the social demographic information. Of course, we talked about the housing service quality and characteristic of each of our services in Italy and all together. Particularly about well-being, we mean well-being not only as mental health, but also in a broader meaning, including self-efficacy, autonomy, self-determination, and this as a guideline that is driving in the research. Main issue about the research and its result is how do our housing services impact on the lives and on the well-being of people? Is there a co-occurrence between their experience and the social support they are receiving and their well-being? These questions are quite crucial and fundamental because they help us having a better dialogue with local institutions. They help us to prove to donors that those social support programs are very much needed and the housing services that we are running are quite working. So another question, is the well-being of the people we are hosting if so, how is being affected by the service quality and by the working alliance, meaning the alliance with the staff members of the housing services. We were able to track in particular and very precisely all these questions in our charts and in our research. About the key findings, because I need to speed up. About the key findings, talking about the impact of services, we can say that 90% experience strong working alliance with staff. This means that most of the person that responded, the interviews and the staff members showed a better well-being thanks to an effective and a strong relationship with the staff members. These participants also reported 14% higher capabilities than the average. When we're talking about average, we mean the average population of young homeless people. So again, these results confirm the positive impact of these services that are tailored and tailor-made and individualized. About the well-being connections, other key findings that are quite relevant for the overall research. The analysis showed that there is a higher perceived capabilities and higher well-being in the person that had experienced the services, and a strong staff relationship and better mental health thanks to the support program of the housing services. So again, these connections are very important to prove the efficacy of our services. In terms of future development of our research of the project, we will be able probably to broaden the network and the sample. The sample of our research now is around 30%. I think I mentioned that. We will develop individualized reports for each housing services that were involved in the work. And we would like also to have longitudinal studies to monitor change in time after they are out of the project. We are about to translate the research in English, but the Italian version is already available at our website. You can have here the QR code where you can download it, the full version of the policy brief and the research report. So I think I was right for the time, right?
More or less, yeah. Thank you, Sylvia. I posted as well the link to the chat. Yeah. Okay. Great. So next to our next presenter now, it's my pleasure to give the floor to Sonika Francis, who is the founder and director of the Black Sex Worker Collective. Currently, the Black Sex Worker Collective is operating in Berlin and with US partners to address housing issues within the queer, migrant, Black, and sex worker community. The Black Sex Worker Collective is a grassroots movement founded in 2018 and rooted in Berlin, the United States, and Ghana, fighting for the liberation of Black sex workers and trans persons through crisis intervention, advocacy, and community-led organizing. They combat state violence, health disparities, and economic oppression by providing direct community care and centering the leadership of those most marginalized. Their work dismantles oppressive systems while amplifying voices through art, political action, research, advocacy, and the demand for full decriminalization. Sonika, the floor is yours.
Hi, everyone. Thank you, Nads. So we embarked on this journey last year to address the housing disparities happening in Germany. This came about because I'm a two-time migrant and noticed living here for 6 years how much our community is suffering from lack of housing. It's rampant. So we set off to do this research. Initially, the plan was to interview just sex workers, but we wanted to get a more broader idea on whether or not if sex work did play a role in people having lack of housing or insecure housing. So we decided to interview everyone in Germany, regardless of what profession they were in and their income, they just had to be part of the LGBTI plus community. So this was not a research project just for sex workers. It was for the entire community to determine what is the cause, if sex work is the cause. So we envision housing without discrimination based on race or occupation. And this study addresses the systematic housing barriers faced by Black, LGBTQI+, and sex worker communities. And our goal was to understand the root of housing insecurity within our communities. So we had a two-stage survey method. The first one was we did an open call. We got 84 responses on demographics, housing, and discrimination in our initial response. And we tried to pare this down to get to 50 participants. We had to do an anonymous process where we figured out who would be the best fit to interview. So out of 50, out of the 84, we narrowed it down to 34 people with income data and narratives. And our goal was again a total of 50 interviews, but we didn't quite make it. So the overview of the demographics: 70% of the participants were non-German citizens, with 46% identifying as non-binary, 44% as female, 56% had college degrees, 41% were pansexual, 23% bisexual, 45% Black, and 48% identified as sex workers. So, surprise, surprise. The key findings: 46% on the report housing insecurity, living in situations that range from stable leases to shelters or couch surfing, and 54% dissatisfied due to racism, financial precarity, and safety. A lot of people that were interviewed did state that not being German seems to have played a factor into them not being getting housing. So folks were experiencing discrimination just based off their last name. And the other key finding was the strong correlation between housing insecurity and dissatisfaction with where they were. So does sex work play a role in housing discrimination? Yeah, it does. So sex workers face higher rates of housing insecurity. They face discrimination based on their occupation, but there was no significant correlation between housing insecurity and race, gender, sexuality, education, or citizenship. I went through this pretty fast. Wait a minute. Let's see it. Okay. So income and debt. So the monthly income levels, they varied widely among the participants, and there was no significant correlation between sex work and being in debt, but that is also based on partial data. So our policy recommendations: we want to expand housing protections to include occupational status, for example, sex work. We want to improve anti-discrimination enforcement in housing, ensure secure housing access for migrants, LGBTQI+, and trans communities, and fund more peer-led research and community-led solutions. This was a great opportunity for us to, as a Black sex worker group, to allow our community and those outside the community to recognize that Black sex workers in particular, we're involved in much more than just quote unquote sex work. We're involved in every aspect of living and life. So this study was important for us to pretty much solidify ourselves as researchers. I hold a master's degree, so I kind of know how to do research a little bit. and the other researchers who are no longer with the group, Olivia and Hannah, we work together to bring this together because all of us at one time or another have suffered from housing discrimination or housing insecurity to some degree. So in order for our community to recognize that this group, as well as groups like us, can be included in other things, we're hoping that this kind of makes the case and we can continue to do this research at some point in the future, because it was very short. We didn't have a lot of turnaround time. We wanted a lot more participants and we weren't able to get it to collect a bit more data. So hopefully we can get more funding in the future and then to expand on it more. If you'd like to reach out to me, I'm available at info@thebswc.org, or you can go to thebswc.org and find more information about us and any other projects that we're going to be doing in the future. And I'm looking forward to any questions, any clarifying. We have the document available that we can share with others upon your request. Thank you.
And yeah, yes, you can stop sharing. Thank you, Sonika. That was like super efficient, quick. I know that you at the end said, that the reach out not as you envisioned, it was not as you envisioned, but I think it's quite a revolutionary study made in Germany, and the first of its kind. And I think it's brilliant. It's a great start. Thank you for presenting, and I hope we will get more questions around that as well. So next to our next speaker, who is Gemma Brues from Ahora Donde. Gemma is a president and a founder of the Ahora Donde Le Refuge. And in addition to her work as a volunteer with the association, she works as the Spanish Business Development Director at an international law firm. Ahora Donde is a Spanish non-profit organization inspired by Le Refuge France and dedicated to supporting LGBT youth who have been rejected by their families. They offer a comprehensive range of support services, including social, medical, psychological, legal, and financial assistance, as well as family mediation, temporary accommodation with the host families, and job reintegration programs. Their primary focus is on LGBTI youth who are experiencing or anticipating family rejection. Gemma, the floor is yours. You're muted.
Okay. Yes, can you see the presentation? Okay, then thank you very much, Nats. Good afternoon, everybody. Thank you very much, Nats and ILGA team and all the attendants today. Yes, in Spain, the situation is complicated because there is no data about this invisible violence and no adapted structure to attend LGBTI youth people who risk homelessness, like we can see in these statistics. Then, as association, yes, we offer the services that Nat has mentioned, and we can say that we have created association in 2019, and we have helped around nearly 100 young people, and we have nowadays 3 host families, but we are looking for social apartments for these people. Our users are really, they are not very active with us. They are in different stages, and sometimes they disappear and sometimes they come back. That means that sometimes it's difficult not to follow all the process with them. The highest percentage of users are trans women, and the ages are from 18 to 23 years old, and more than the half are trans people. And about sexual orientation, yes, the majority, they don't want to share their sexual orientation, but you can see that they are young people and with this situation of rejection from their family. About the sociological study that was prepared and all the report from the Universidad Rey Juan Carlos from Madrid and financed by ILGA. We have prepared, yes, a resume, and then we can say that in Spain, there was just a report from FACIAM study, and there were no statewide data. That means that it was very difficult to cross the data from LGBTI youth people and homelessness. Then we have visited around 30 Barcelona's public shelters, and we have 272 respondents and with 38 LGBTI people, and 234 non-LGBTI. Then the majority of them are cis gay men between 35 and 44. And the majority of them are from other countries. They are migrants. And we have to say that Ahora Donde, we are complementary of ACATHI. ACATHI, they are more focused on a migrant, and Ahora Donde with young people, independent of their origin, but they are residents of Spain. They have closed the family. Then the majority of these data are the 31% were cis women, and the 21% were trans women. And we can say then from, yes, the respondents were between 18 and 30 years old, more or less the 23rd percent.
Gemma, I'm sorry, if you're talking about the slides, you need to show them, because for
Yes.
now we only see the first slide.
Okay.
Yeah,
Wow.
so you need to scroll. So when you, yeah.
Okay. Yes, because now it's okay.
Yes.
Okay.
So,
Then
yeah.
it was
Thank
was
you
the
for
number of users that we have had until today, and the profile of our public, youth people. And here, this is the sociological study, and what I have mentioned about that there's just this report. Here we can see the profile of these people that have answered the survey, and nearly 82%. They have request specific LGBTI housing, but they have to go to a generic shelter. And for that reason, yes, we can say that these people have suffered, majority of them have suffered violence. Then and some of them we can see here that have practiced prostitution correspondent to gay men 66% and trans women 33%. And the causes of homelessness, the majority of them were the family breakdown, migration, problems maintaining housing and eviction, and as well as economic and employment problems. Then what I have mentioned before, yes, they have suffered, nearly 80% of LGBTI young people have suffered a crime while in a street situation. And among the most serious crimes, there was 31% reported having been sexually assaulted, and almost 50% reported having physically assaulted or insulted. For that reason, it's very important to have this shelter the first months or perhaps years, have these shelters that focus on LGBTI youth people. Then we can say briefly the conclusions that there are more important differences in the LGBTI youth homelessness population in the city of Barcelona. For example, we can see that in Madrid there are specific shelters for LGBTI youth people. And also it's very important training the professionals with diverse and quality intervention. And we can see that there's a lack of access to LGBTI homeless specific resources. There are relevant causes of homelessness due to discrimination based on gender identity and or sexual orientation, and especially with migrant population. LGBTI individual experience, they have higher rates of discrimination. We can compare with other population. And the administrative situation of migrants, it's also complicated. I suppose that Rodrigo from ACATHI is going to explain more detail in this subject. Then, which are our proposals? Create specific public residential centers, because there are some centers for other situations, but not for this LGBTI homeless population. We need grant and public support from entities, and continue to expand the research, to have data. If we have data and statistics, the government administration will be more interested in this problem. Then create training programs for professionals who serve LGBTI homeless people. Very important emotional support, mediation, then have a psychological team. Awareness campaigns, sensibilize the people, the families, that they have to love their children, then we are trying now to convince the government to do public campaigns. And then continue with collaboration projects between the social sector and public administration, and also with other institutions, associations like ACATHI and other associations that we cooperate, not just in Spain, but also worldwide, because we belong to Le Refuge Federation in Europe with other countries. Then we try to do lobby on this violence, invisible violence and problem that we have nowadays, especially with young people. Thank you.
Thank you, Gemma. You made a very good bridge for me to introduce the next speaker, who is also from Spain. Yeah, Barcelona. It's your actually partner organization, ACATHI. Let me introduce Rodrigo Araneda Villasante, president of ACATHI and project coordinator in the field of asylum and LGBTI rights. ACATHI is a non-profit organization based in Barcelona. It supports the rights of LGBTI migrants and refugees, promotes their autonomy, community inclusion, and access to rights through individual support, advocacy, and community-based initiative from an intersectional perspective. ACATHI works closely with individuals in vulnerable situations, including those in reception facilities, in detention centers, and in care settings. Rodrigo, the floor is now yours. You can share the screen and come in. We don't hear you, so you might need to unmute yourself.
Homelessness in Barcelona. Good afternoon, everyone. I am Rodrigo Araneda, president of ACATHI, and I will be talking to you about the research project Somewhere Under the Rainbow, Understanding and Addressing LGBTI Homelessness in Barcelona. ACATHI is a Barcelona-based association that has worked for over 20 years to support, protect, and advocate for the rights of LGBTI plus migrants and refugees. Our work includes social and legal support in asylum, regularization, and access to fundamental rights, safe spaces for participation, empowerment, and mutual support, policy advocacy to challenge exclusion and promote inclusion. Through our daily work with hundreds of people each year, we have seen that homelessness is a growing and deeply under-recognized issue among LGBTI migrants and asylum seekers. Many of them face family rejection, violence, and structural discrimination, which often lead directly to homelessness. Yet their experiences are absent from official data, overlooked in public services, and missing in policy responses. We launched this research to amplify the voices of those pushed out of their homes and excluded from systems, generate evidence through an intersectional, community-based lens, and push for policies that put dignity, safety, and justice at the center. Methodology. This was a qualitative research study carried out between October 2023 and January 2024. We conducted 9 in-depth interviews using a life story approach, which allowed participants to share their personal experiences of exclusion, survival, and resilience in their own words. Participant profiles included trans women and non-binary people, migrants and asylum seekers, people living with HIV, formerly incarcerated individuals, people who have experienced substance use or survival sex. The study was guided by an intersectional framework, recognizing how different forms of oppression, such as racism, transphobia, poverty, and xenophobia, combine and reinforce each other. We also worked with a multi-sectoral steering group, including social service providers, public institutions, e.g. City Council, Mossos d'Esquadra, NGOs, e.g. Arrels Fundació, Metzineres Centre Assís, community leaders and activists, This collaborative structure ensured that the study reflected both lived experiences and systemic insights, helping to bridge gaps between research practice and policy. Main findings 1. Pathways into homelessness, family rejection due to sexual orientation or gender identity was the most common trigger. Many participants experienced physical or emotional violence at home. Some attempted suicide or were forced to leave their homes as minors. 4. Migrants and asylum seekers. Homelessness often began upon arrival in Barcelona, with no support network or resources. Second, intersectional discrimination. Participants reported multiple overlapping forms of discrimination, transphobia, and racism when seeking housing, employment, or support, Islamophobia in shelters or from institutions, sexual violence, especially toward trans women and non-binary people. Out of fear, many avoid shelters, leading to hidden homelessness, e.g., couch surfing, unstable rooms, unsafe spaces. 3. Barriers in accessing services. Public services are often rigid and not adapted to LGBTI realities. Complex rules, e.g., needing 4 months on the street to qualify for shelter, lack of LGBTI-sensitive support, and poorly trained staff. Misgendering and lack of safe accommodations, especially for trans people. Community-based organizations like ACATHI were identified as trusted, inclusive, and supportive. 4th, impacts of homelessness. Living on the street causes chronic insecurity, trauma, and exposure to violence. Participants described a lack of privacy and dignity in shelters. Many relied on activism, informal networks, or sex work as survival strategies. Even after accessing housing, the experience was marked by instability and constant fear of returning to homelessness, especially after prison release or asylum denial. Recommendations and action proposals. 1. Public policy and coordination integrate LGBTI perspectives into municipal and regional homelessness plans, e.g., EXAPCEL and the Catalan Homelessness Framework. Ensure that LGBTI-specific needs are recognized in gender and diversity policies. Invite LGBT organizations like ACATHI and Ahora Donde to participate in decision-making spaces. 2. Housing and social inclusion. Develop safe transitional housing projects managed by LGBTI-friendly community organizations. Guarantee access to public housing and employment for LGBTI people, especially trans women, through anti-discrimination measures. Facilitate civil registration, empadronamiento, and the legal name and gender change process for trans and non-binary people. 3. Inclusive and accessible services. Train social and healthcare professionals in LGBTI-sensitive and intersectional approaches. Identify and eliminate barriers in service access, including overly restrictive requirements. Ensure shelters and support programs are safe, respectful, and inclusive for LGBTI people, especially trans individuals. Promote inclusive signage and welcoming visual cues in institutions. Create a map of inclusive services and support interagency collaboration. Visibility, research, and awareness. Collect data on sexual orientation, gender identity, and experiences of homelessness using safe, respectful methods. Acknowledge and address hidden homelessness, e.g., temporary stays with friends, unsafe housing, or sex for shelter. Promote awareness campaigns against LGBTI phobia and aporophobia, discrimination based on poverty. Learn from international good practices like Housing First for LGBTQ+ youth in New Zealand or 2 Housing in Turin. 5. Urgent and structural measures. Create emergency shelter spaces for asylum seekers with LGBTI-sensitive protocols. Ensure immediate access to basic rights and services without exclusionary criteria. Provide food and hygiene alternatives that avoid re-traumatization, e.g., takeaway meals for trans women avoiding communal dining. Thank you for your time and attention. This research is not just about data. It's about real lives, resilience, and urgent action. It challenges us to build inclusive policies, to rethink how we address homelessness, and to ensure LGBTI migrants and refugees are not left behind. We invite institutions, professionals, and communities to join us in transforming care systems and ensuring dignity and safety for all. Let's make sure no one is invisible and no one is left without a home. Thank you.
Thank you. Thank you, Rodrigo. With the use of multimedia as well. And our last speaker, we're on time now. I would like to invite and give the floor to Simona Murshets, President of Ljubljana Pride. Ljubljana Pride is a non-governmental youth volunteer organization that works to empower LGBTI people through activities based on non-formal education, peer learning, activism, and in-depth mentoring support. Their primary target groups are LGBTI youth in Slovenia and all those working with LGBTI youth. And they are targeting specifically LGBTI youth who face intersectional discrimination. They also have a separate project, which is QUORE program, that offers short-term crisis accommodation to LGBTI youth in situation of housing exclusion and or homelessness. Simona, the floor is yours, and you're the last speaker to summarize things as well.
Thank you very much, Nads. I'm going to do something very radical, and that is I'm not going to show you any presentation. I'm just going to take the 7-8 minutes and try to have a conversation highlighting a little bit of what is the situation here in Slovenia and what we as Ljubljana Pride Association tried to do and where we are right now. Because yeah, as you can imagine, Ljubljana Pride Association, we are a pride organizer and we are youth-led, but primarily activist organization, right? So we are not, in our way of functioning, we are not oriented into providing services. That has never been our primary goal or ambition. However, throughout the years, we realized that we can only have LGBTIQ+ young people whose voices can be heard and who can be represented in different structures of society, local community, and so on. You know, if we also as an organization are able to support those that are most vulnerable because nobody else was doing it. So eventually, as Nads was mentioning, we've developed a program called the QUORE program. And what happened is that somewhere in 2017, we came across this magazine of ILGA-Europe that was covering LGBTIQ+ homelessness, and it struck home. It's something kind of like clicked, and we were like, okay, who are the most vulnerable within our communities? LGBTIQ+ young people, and nobody was doing anything about this in Slovenia before. And we as an association, we had no clue about the very specific dynamics because we never worked on topics of homelessness, and we never before provided professionally care or any kind of support services. So it took us a couple of years. It took us getting support and information from both FIANZA on a European level, from True Colors United from the US. And at the end, what really kicked it off for us was actually the first No One Left Behind fund from ILGA-Europe that in the period of 2020-21 supported us in the first project where we actually did the research. So basically, I could now almost repeat this very professional intervention by ACATHI from Rodrigo right now, because we did the research with LGBTIQ+ young people who experience some kind of housing exclusion or deprivation, and in the age of 16 years to 29 years. And this is the legal kind of framework of who is young in Slovenia according to national legislation. And in 2021, this was post-COVID time, we published the first type of research report that ever existed in this country. So up until that time, nobody ever did anything specific on youth homelessness, yet alone LGBTIQ+ youth homelessness. So the other homelessness service providers, they had experience from the ground that was telling them about there is need and there is young people in this precarious situation, and very often they're LGBTIQ+ young people, but that was all. So practitioners in the field knew there was a problem, and we talked with them and we worked together with them, but there was no recognition institutionally anywhere in policy and nowhere in any kind of service provision, neither for young homeless people nor for LGBTIQ+ homeless people or facing housing exclusion. So we did the research and we collected the data, and basically for the first time ever, we managed to, even in Slovenia, bring in concepts like what is emotional and physical safety, what is appropriate housing, what is accessibility in terms of capacity to cover, kind of like running costs, what is the stability in terms of long-term housing retention and things like this, because nobody was really doing this before from the perspective of LGBTIQ+ young people. And that survey report also had 11 recommendations in the end, from like training professionals to finding short-term emergency crisis accommodation to like long-term accommodation and all kinds of other like 11 recommendations in total. And many of these things you've heard in the previous presenters speak about. The situation is not much different in Slovenia. So then what we did is, in the second No One Left Behind project that most of you were presenting your results from, we focused on something else. We focused on advocacy. Because as an activist organization, we felt that that's the path we can do. We did build some of our own services, like short-term crisis accommodation of like 2 weeks with private hosts. And we also started to map another target group for us, which more and more became obvious somebody needs to do something about it, which is the LGBTIQ+ asylum seekers here in Slovenia. So again, story that you've heard from previous speakers, and many of those are also our partners in singular projects or in the cooperation. So we as an organization said, okay, we will try to focus on advocacy. So the whole project was about building an advocacy strategy, and not just an advocacy strategy only in the area of how do we address LGBTIQ+ youth homelessness in Slovenia, but also just how to equip ourselves as a team, a small team in an activist organization to shift into the work of advocacy. How are our program coordinators able to do advocacy work in their fields? And not just the activistic or youth work related work, but also the advocacy part. So we developed an advocacy strategy, and very important part of that advocacy strategy was obviously also advocacy in the area of what do we want to reach in terms of addressing LGBTIQ+ youth homelessness, but also the specific precarious situation on LGBTIQ+ asylum seekers with the correlation to housing and homelessness. And so one of our most important outputs of this project at the end was a first time ever publication where we in-depth described the situation of LGBTIQ+ asylum seekers in Slovenia. What are the precedents? What are the cases? What's the legislation? What's the specific situation? Obviously, including into this report also the experiences and voices of people in the situation, living in the camps, as users call it here, and so on. Because why? We realized that for us to do advocacy, we needed the two sides. We needed the research, the survey on one side. We needed, well, an advocacy strategy with advocacy goals for our teams on the other side. But then also there was a gap in between, more structural knowledge, the kind of knowledge that policymakers, people at the ministries, but also media and others can get. I mean, sometimes it sounds maybe not so nice, but also somehow get recipes where we told them, look, this is the situation, this is what we need you to do. So we came up with this kind of a document in the end. And I'm all of both the survey and the report are in Slovene language with English summaries. And I'm very happy to tell you now, for the very last thing is that later this year, after we finish Pride, which is pretty much in 10 days time, we are also going to publish the complete English and complete French version of it. So anybody who's interested, you will be able to actually read the reports also in English language and in French in total, because we also wanted to make it available for people who find themselves in these situations, that they have also the access to this knowledge. So I would stop here with this, and thank you very much for your time.
Thank you so much, Simona. So this is the end of the part where we're listening to the amazing presenters. Thank you so much. I have a couple of questions, but I also think that it would be interesting if anyone actually from the audience would want to come in and comment on what you've heard or share what is your situation on or challenges on homelessness. Please raise your hand, and we will let you in. Or you can also ask questions in the chat. While we're waiting for that, I wanted to actually a bit piggyback on what you, Simona, was talking about advocacy, and ask our presenters. I think that one of the very challenging things is like several. The first one is definitely data gathering and getting the data and getting the resources to get the data. But then there is a different bit, which is actually then use this data in order to have different conversation and bring it to different spaces and actually kind of make spaces where this data is heard and acted upon, which is advocacy and different networks conversation and conversations with partners. And I know that some of you shared a bit of your experiences and some of you shared the policy recommendation. I wanted to ask those of you who wanted to come in from the groups that presented on a practical level. So you've done research or you've worked, you've got kind of the data, you've got stories sometimes. Can you share a little bit and I know that some of you've made presentations for the community or for policymakers. I wonder if you can share what are the spaces where you brought this data in one way or another in any conversation. Maybe it's, a couple of numbers, or maybe it's a more in-depth sitting with the municipality. I just wonder on a practical advocacy level, how did it play out? If it play out, were there a little bit breakthrough, even if sometimes it's a little thing, somebody from the municipality listened and did this and that, or maybe you can reflect on what is still or becoming more challenging in the current situation for this conversation to happen. So it's a very practical kind of reflection point. It doesn't mean that, like, we want to have success stories, because it's always very different, but difficult. But I wonder if you can reflect on that, if anyone wants to come in. Rodrigo, I can see your hand, and then Sonika, I think you unmuted, and then Simona.
Excuse me for my English. We use more the data. We present the investigation in Barcelona with presence of the social services, and with this we talk about the make trainings for the persons in social service, and we work more in the municipal level, for it's more a prop of the situations. With the Generalitat, is the region government, is a little complicated in this time, but is now new. For this is we start now for work with the regional level.
Thank you, Rodrigo. Sonika, I think you wanted to come in.
Yeah, thank you for the question. Also, on a practical level, we brought this into several advocacy organizing spaces. One was with, ILGA, of course, where the findings help shape some broader regional discussions around queer and trans housing access. We also shared the data during webinar following the launch of the Unprepared Community Report on Access to PrEP by Sex Workers, where housing insecurity came up again and again, especially in regards to healthcare access. And one breakthrough was how clearly the data showed that housing insecurity wasn't just about income or legal status. It's directly tied to being a sex worker. So this shifted the conversation in a few policy circles that we're in, and making it harder to ignore the occupational stigma as a structural barrier. At the same time, we're still hitting a wall, though, because many of these housing spaces still are excluding sex workers, or we're actively being excluded or being ignored. So there's still like a discomfort around naming criminalization and stigma and racism as core housing issues. So the challenge now is to not just present data, it's that demanding that people center the most marginalized in their policy solutions. So we're continuing to push for peer-led data like this to be respected and valid in all those spaces.
Thank you so much, Sonika, for this great comment. Simona, you wanted to?
Yeah, as I said before, I think the first and for us, very, very important part of it was that we managed to empower our own team, meaning that also we gave the arguments and the knowledge and the data to ourselves so that we can use it, because as a Pride organizer, for example, we have, at least during the Pride Festival, for example, we have certain level to access to the media, for example, and how we can articulate our political message and how do we put these things forward. So for us, we use actually a lot of what we did. We use it in our daily work like this, just to in our communications and PR and things that we try to do. So that was one part of it. And because, as I said before, our team, we are not experts in these areas, right? Nobody's a lawyer, nobody's even a social worker, right? In that sense. So it's also a bit like, for us, it's important to have that as a backbone for ourselves to feel more, that we can say something about it and that we are supported by some formalistic knowledge. The other part that is important for us is because we were now involved for the past year and a half in the preparation of the first LGBTI strategy in Slovenia. And then, for example, what we did concretely is, which is led by the Ministry of Labor and Social Affairs. And what we managed to do is that we took over the chapters that particularly deal with these topics. And then we fed those chapters with the analysis and mostly the recommendations from the data. And I think that is another way than how directly we managed to do it. And we will see. Unfortunately, this is still up for political decision. So I cannot say that we've succeeded, but I can say we've used it.
Thank you. Yeah, Sylvia?
Yes, thanks. I'm going very quickly add that when we started 7 years ago, when we were preparing our project, our housing services, I wished we had the data that we have today, because at that time there was no literature at all. I'm talking about the Italian situation. There were no data, no context, no literature. There was something at European level, but it was not enough. So I wish we had these researches that we all been doing together now. But what I would like to add is that we need to bring all the data now at higher level in terms of advocacy at European level. That's what we would like to start with new programs. And we need to find a long-term support program in order to be able to bring those data in Brussels, to bring those data at the European Parliament level. So we just started with our set of recommendations. Thanks again.
Thank you. Thank you, Sylvia. Gemma, do you want to add something?
Yes, as Rodrigo say, no, we have organized an event with the administration, government, Generalitat, and City Hall. Then we have pushed that we need. We have informed about this report, this information about our own data, because we are all the time pushing to have social apartments for these youth people. And if it's not the case, we use this information also to the media, to our social network, to have to obtain host families, because we think it's really interesting, this model, because it's a win-win. Then yes, for that reason, it's very important to have this information, this data, this number, to sensibilize the families and the public that yes, that there is this problem. Thank you.
Thank you. Yeah, that's what I'm hearing is that like having data, using data, and succeeding with data is kind of three different steps. There are sometimes in time take a lot of time and take a lot of effort. It really depends as well on the local context and the connections, but also on political situation to be honest, who are were in power. We don't have now any questions in the chat, so I think I will bring another one that I had for myself, just being curious. I know that based on your presentation, but also actually reading different briefings and your reports, and I feel like there is a lot of overlap, and there is a certain things that you now have data to prove, but you kind of had this idea before starting research, and there is things that across research I even saw you nodding because across the context it's true. For example, intersectional discriminations, that trans people are more affected, that trans women are more affected, the importance of like in the discrimination of occupation as a sex work, and so the importance of training. I just wonder if I wanted to ask if there was a finding or a data or something that you didn't expect actually this to come up in your survey or in your experience, something that you didn't anticipate it, you didn't have a hypothesis, or you had a different hypothesis, and then actually you got a number where you were, like where research actually gave you something new. If that was the case in any of your studies, or mostly it was something that you already knew from your work, and then you just got data to back it up. Who wants to come in? Sonic, I was thinking about you because I actually read your summary, and a lot of new things came up for me. Yeah, please come in.
There's a couple of things. I can't remember some of them. I think, oh gosh, I can't remember some of them, but some of it was like over half of the participants had a college degree, yet they were still facing housing insecurity. So that challenges a common assumption about education, alone being like protective, so that it clearly is not. So that showed how systematic discrimination and stigma override, that social mobility aspect that we were all like taught that we could rely on. And some people were like on formal leases, but still reported feeling insecure and dissatisfied with their housing. So just because you have a roof over your head doesn't necessarily mean like you feel safe, and secure, especially like if racism is playing a part or your safety is being threatened. So yeah, the data confirmed what we knew, but definitely revealed some interesting aspects. There's some other stuff too that I don't remember right now because it's been a year, almost a year since we at least had the event. So some of it I don't remember, I wish I could remember because there was some stuff that I was like, wow, this is surprising, but it's not. I'm a little tired, so it's not quite coming to me right now. But those two factors.
Yes, thank you so much. Anyone else to come in?
I can share too. Yes. So in the first research about the LGBTIQ plus youth homelessness and housing exclusion, I think for us we did expect it to a certain degree, but not to that degree, is the fact that how much people do not identify with the concept of being homeless. So meaning that for us, it was a huge struggle to gather the data in a way that, that afterwards that we would formulate the questionnaires, but also the other ways how to ask people about their situation so that we could afterwards apply the classification. Because people were in the most precarious situations ever, but they would still not consider themselves as falling into this category of homelessness. And so I think that this invisibility of this all kinds of different ways of housing exclusion and homelessness, that was something that really was present very strongly. And then in the report about the situation with LGBTIQ+ asylum seekers, I think what surprised us the most is that we actually expected the situation to be worse. But we expected it that if you are an LGBTIQ+ person persecuted because of your sexual orientation or gender identity, and you come to Slovenia and you seek asylum, we expected it that the system would just kind of like say no. But actually what we realized is that if people disclose in the first interview, that official interview that they have, that they are LGBTIQ+, and they are seeking asylum because of persecution on this category, actually, a lot of the cases, they have positive afterwards. They get a positive. The problem is that 99% of the people don't disclose in the first interview. Obviously, being afraid, being, kind of like violated through everything that happened before to them because of this. So of course they don't feel safe to say it. And this is where the real problem in Slovenian system happens, is because if you disclose later and if you change your story, they treat you like a complete liar. And it's almost impossible then to claim your rights afterwards if you want to like disclose in a second interview or in a later procedure. So this was something that we had no clue before, and we learned now. So now we're trying to deal with this situation.
Thank you, Simona, which actually speaks for me back to what Sonika said, that systemic discrimination as well feeds into how people then tell the stories and how they can navigate or cannot navigate the system as well. Gemma, I think you were...
Yes, just to say that after all this data, all this information that we have presented to the administration and the government, we are really surprised that they have not reacted yet. And try now to implement measures, because it could be political measures for them, and it could be positive. And we also propose to do campaign now during the Pride about this situation, and they are thinking about it, but we are going to find another way to to explain this data, and with the media, for example, and other channels that the people, families can realize that this is happening.
Thank you. Sylvia?
Yes, I can have a very short comment. I cannot say that we had surprising results. We rather had some, I knew it, like confirmation about most of the topic that we were addressing. We were, though, surprised by the high number of participants to our questionnaire and interviews. That is something that we did not expect, because most of the people that we are hosting or have hosted do not want to re-elaborate their story. But indeed, on the contrary, we had many participants, more than we expected, and that shows that maybe the empowerment strategy worked, and they were willing to support other fellow people. So this is quite interesting for us.
Thank you, Sylvia. So we don't have any other questions. So, and we are actually just Rodrigo, come in.
For us, it's important for make visibility about these things. Think in the categories of ethos is a type of the categories, is for the person not recognize, say, the combined, say the same, but we need make a campaign the diffusion of the data, but in the language more proximate for the public, not for the for the political level. For the political level, we try, but the political level is make only testimonial things. We we make more than the political level. We have more flats, but it's more sports for the organization and not for the administration.
Thank you. Thank you for your comment. Our time is came to an end. Thank you so much for the discussion. I hear that there's we need to not only just keep talking, but bring this data to different places, which requires different language as well sometimes, because what Rodrigo said, like the general public is one, the community is another, allies and partnership is the third places, and politicians, I think on local level, national level, and then on the EU level is also very different approaches. We will continue trying to find spaces to have these conversations. Just to let you know that the recording, it's going to be a recording of the session. And in September, we will have a bit of a package which will include this recording, a short documentary. We will gather links to reports of all 5 organizations, and we will have a briefing, a summary briefing in English of all 5 research that analysis group is helping us put together. So we will continue sharing that. We will share with everyone who registered for the event for sure. Thank you for being here, for sharing the space and holding the space. Yeah, and I wish everyone a good summer, resilience, good Pride Month, strength, and yeah, love as well, as we know that's
Thank
important. Thank you.
you.
Cheers.
Thanks for the opportunity.
Thank you.
Bye.
Bye.